Welcome, everybody. It's Tuesday, which means it's time for our Q&A with the family support team at the St. Louis Arc. I'm Sharon Spurlock, and I'm really happy to have our guest today from Metro St. Louis. I want to introduce Amy Parker with Metro. And Amy, if you can tell everybody a little about your work at Metro, that would be a great place for us to start.
Okay, well, thanks for having me. I'm really excited. So I have worked at Metro Transit for 15 years since October was my 15-year anniversary. Before I came here, I was an occupational therapist in another life. I worked in nursing homes and hospitals and things like that. And then I found myself at Metro doing eligibility assessments for people who wanted to use our Call-A-Ride service. For a couple of years, then I was a transit service manager for Call-A-Ride, which meant I got to do things like um, greet operators for their day, maybe go and help them if they needed some help, things like that. And then for the past 5 years, I've been in this job, which is called ADA coordinator. So that means that I get to think about all things about the Americans with Disabilities Act and how it applies to us here in transit. First, just thanks for coming to hear about what we offer here at Metro. We want our whole system to be accessible to people with disabilities. So that's an important thing because sometimes people think that Call-A-Ride is the only thing that applies to a person who might have a disability. This is me. My name's Amy, and this has how you can contact me. You can always email me at adacoordinator@metrostlouis.org, or you can give me a call on the phone at 314-982-1525. So Metro has a lot of different modes of transportation. We can think about Metro bus, that's the big buses that drive up and down a certain route, and they go on a schedule. So you would go out and stand at the bus stop, or maybe sit if you're lucky enough to be at a location where there's a bench or a shelter at your bus stop. And then the bus would come by and you would get on and pay your fare. MetroLink, we sometimes call that the train. So that's our light rail system that can take you to, I believe it's 39 different stations, exciting places like the stadium, Scott Air Force Base, all the way down to Shrewsbury, and all the way up to the airport in case you're trying to go somewhere else. Then we have Metro Call-A-Ride. Metro Call-A-Ride provides our ADA complimentary paratransit. That is for folks when they have a disability that prevents them from using the Metro bus or the Metro Link. Now, the cool thing I think is that just because you need Call-A-Ride sometimes doesn't mean that you couldn't maybe use the Metro bus or the Metrolink for some of your trips. Sometimes there's trips that you can do on the Metro bus, and then trips that you maybe haven't learned how to do, you would use the Call-A-Ride for. Our newest mode of transportation is called VIA Metro St. Louis, and that looks like those minivans that are black and blue with the Metro symbol on the side. And they operate in particular areas during particular times. So for example, they serve North County where a lot of our buses stop running at 8 p.m. They also serve some areas in West County and South County where there's not enough people that maybe want to ride the bus all the time, but there's still people who need to get where they need to go. And with VIA, you use your phone, either your smartphone on the app, or you can call them and you ask them to send you a vehicle. Now you can tell it if you need a van where you can ride with your wheelchair. You can tell it if you aren't able to cross the street and you need them to drop you off right in front of where you're going. So you can let them know those sort of things. The other thing is that we offer travel training in our department, and that's where you would meet with one of our travel trainers, and they're going to help you figure out your route on the bus, figure out how maybe you might take the MetroLink and then get a Via. So they would do all that stuff with you. They would help you figure it out and practice with you until you and everybody who cares about you is confident that you can do it and you know what to do if something doesn't go right.
I've always told people that they can utilize travel training more than once. So if I need to learn how to get to my job and get some support to use the Metro bus to get there, I can do that. And then if I want to learn to get to the gym on a different day, then that's a separate opportunity. Is that right?
Yes, there's not a limit on how many places we help you learn how to get to. And some people go through travel training each time. Other people maybe start learning how to use the transit app or how to schedule their trips themselves. And maybe they just call up and say, Miss Sabrina, I think this is what I need to do to go here instead. And she'll be like, you got it. Or, well, let's practice that. Okay, so then here were just some of my thoughts. Which one is best for me? So the short answer is it really depends. It depends on where you're going, what are your skills, what are your strengths, and which one is going to maybe be available to connect you where you need to go. So again, Metro Bus and Metro Link are going to go the exact same way every time, take the same route, and they run on a schedule. And it's the lowest cost option. One, because we offer a reduced fare for people with disabilities, and that's either if you receive Medicare or SSI or Social Security disability, or if you have your healthcare professional or maybe your person at the ARC can sometimes be the one to fill out a verification of disability form. If you're always able to catch the MetroLink and Metro Bus, but you have a disability, you can ride for half price. If you need Call-A-Ride for some of your trips, then you get a card that lets you ride Metro Bus and MetroLink for no fare. That's a relatively new program that we have because we want people to be as independent and spontaneous as they can. Some people need Call-A-Ride, and that's okay. And Call-A-Ride sometimes works best for people. But for other people, if they can catch the bus or the train, we want to encourage them to do that. Or maybe you just get to ride for free if you're going to the baseball game with your family, something like that. So Metro Call-A-Ride and Via Metro St. Louis, those are both what we call shared ride services. And they don't always take the same route, and they cost a bit more. Metro Call-A-Ride is going to go the same places and destinations during the same times of the day that Metro Bus and Metro Link operate. Because remember, that's replacing Metro Bus and Metro Link when you need a bit more help. Via Metro St. Louis is in some different areas where we don't have as much bus service. And we'll look at those maps and talk about how you can figure out if Via is an option for you. So how you can get started. One thing you can do is you can call our Transit Access Center. Their phone number is 314-982-1510. That's the number you would call if you want to talk to a travel trainer. It's where you would call if you have some more questions. Should I get a reduced fare application for Metro Bus and Metro Link? Or should I get an application for Call-A-Ride? Now remember, if you are eligible for Call-A-Ride, then you get to ride the Metro Bus and Metro Link for no fare, so you don't have to worry about trying to pay half fare. I should probably say that for Call-A-Ride, to be eligible to use Call-A-Ride, there is an application, and I can show you what it looks like. You fill out part, your healthcare professional fills out another part, which might be somebody from the ARC, or it might be your social worker or your doctor or physical therapist or anyone like that. And then once we get those pieces back, we're going to set up an appointment for you to come down to our assessment center, and you'll talk with one of our very nice mobility assessment evaluators, and they might have you take a practice, a pretend trip on a bus, or they might have you walk around outside with them, maybe cross the street, see how well you know all the rules to cross a street safely, things like that. The other thing you can do is you can look on our website.
I do have a couple of questions, and this comes up all the time. We have someone who lives just 2 minutes outside of the Colorado area, and is there any way to either have more flexibility about that, or do you have any tips for them as to how to get to that route location?
Your eligibility isn't based upon where you live. It's just where you can take a trip. Our boundaries are the boundaries, and they're really based upon where Metro Bus goes. Sometimes people will come into the service area to meet their vehicle. That can be a challenge. You got to be there and have a phone number where we can get to you. And like if Call a Ride comes to drop you off and maybe you're meeting somebody, if that person's not there, that can be pretty challenging.
So for example, if there was a coffee shop 3 or 4 minutes from my house that was in the Colorado route, I could arrange to be picked up there and then figure out how to get there from my house. But that's really the only, there's no way to get the door-to-door transportation from to my house.
That's accurate, Sharon. And I don't have the liberty to be able to help you figure out if that coffee shop is going to work for you.
Sure, I totally get that.
Yeah.
Yeah, and I think sometimes people don't understand that this is an ADA compliance thing where you are required by law to make accessible the options that are available to everybody else. So if there isn't any bus service near your home, there also doesn't need to be any Call a Ride service near your home. So that's sort of the defining parameters around all of that. So one more question before we move on to the website, and that is, if I've had a Call a Ride card for a while, do I need to get a new one in order to get the free fare on the Metrolink and bus, or does it automatically happen?
If you have a Call a Ride card that does not say Gateway on one side, red Gateway, then we need to get you a different card. So it looks like this on one side, and then on the other side it will say reduced fare permit, ADA paratransit, and it will have your picture. If your card doesn't look like this on one side, you want to give us a call and we'll help you sort through that.
I have one more question too, because it was on my list, and it was about adding buses or shelters. If somebody really needs to have a place to sit while they wait for the bus, what's the process for determining where those get added? Is there a way to advocate for that? Is there a time when you all go back and evaluate that?
So you can always call our regular customer service, 314-982-1406. And you can always let them know that you would like to have a bus seat or shelter somewhere. And then our planning department is going to look at that, and they have to look at how many people might benefit from that, and is there a place to put it? Because when we're talking about an accessible bus shelter, sometimes it takes up more space than what we think it's going to take. So they're going to look at all those things, but we do love to hear from our customers about what they would like. Okay, so if we're here, we're at our metrostlouis.org, and then accessibility. So I go here, I click on rider info and accessibility. And this it talks about reduced fare. These are our applications. Metro Bus and Metrolink reduced fare application. That's if I just want to be able to pay half price on Metro Bus and Metrolink. This one's a PDF. This one is in Word. This is our Call-A-Ride application, and I'm pretty proud of it. If we mail it to you, the pages that you fill out are yellow, and the pages that you take to your person are blue. And we found that that makes it a little easier for people to know what to do. So we've updated this, and it gives you instructions. You can upload it onto our website when it's done. We have some really savvy people. And we want you to keep these instructions if you're going to fill this out. And then here's the part that you fill out. And I'm excited because this is what they call an accessible PDF. So somebody who uses a screen reader can also use this, and you can write on this. And then you can save it and upload it, or you could print it out and mail it to us if you prefer. So here's the stuff you tell us: your name, your address. Do we need to give you information in a different kind of format? Do you use a mobility device? We've recently gone through and tried to make these questions a little easier than our old form. And then this one is called professional verification, and that's filled out by your healthcare provider. And back here, it kind of gives you all these kind of people would be fine to fill it out. Somebody who knows about your disability and what makes it hard or impossible for you to use Metro Bus and Metrolink. And then all these down here, you don't have to, if you don't have epilepsy, you just say, this doesn't apply to me. Do you have a cognitive or a psychiatric disability? Here's a couple of questions. Do you have a cardiac condition? Do you have blindness or low vision? So these are just to help us get better information so we don't have to keep asking you the same stuff over and over again. So that's important stuff on our website. This is also kind of our big book, and we have it in a print form. I'm happy to mail it to anybody who would like to have one. I can send it in the mail. If you come in for a Call-A-Ride assessment, you're going to get one. On the back, we've got the most important phone numbers to make a reservation, cancel your ride, or call my office. Information about travel training. If we go up here where it says services, here's where we can look at the different things, and we can look at VIA. So here, let's see, have we seen somebody have more interest in North or South County? Let's
Go to
look at
West.
West. So, and this is something that I find a little hard, but here's the map and shows you where it is, but here's some places to give you some ideas. The major hospitals, the Chesterfield YMCA, Del Mar Gardens. So you can travel anywhere. You can have them pick you up anywhere in this zone. Does the map show where you can be picked up? The bestest way is to download the app, and you can type in an address and it's going to say in the zone, out of the zone.
Yeah, those numbers are just popular destinations, but anywhere that's in the white is an area where you could get a pickup, correct?
Yes.
But not all the time.
This one, West County, is 5 a.m. to 10 p.m.
Okay.
I do want to show a South County because this is a bit interesting, because what's good is we've got the Shrewsbury Metrolink station and the Hampton Loop, Hampton Gravois. So maybe I live in the city and I can get to the Metrolink, but I work at the Gravois Bluffs Walmart. I can take the Metrolink to the Shrewsbury Metrolink station, and then I can have VIA to take me to my job out at Gravois Bluffs.
And how much does it cost for me to have VIA take me to my job?
$2.
$2.
Or if I have a bus pass, that works.
So I think I'm understanding something that I didn't understand before. If you go to the North County one, their availability is much less desirable. And I guess that's because more people in North County take a bus regularly. Is that correct?
because we have bus service up here during the day.
Okay. So
Mhm.
you still have, you've got bus service in West County, but it just is irregular, or do you not have bus service during the day?
So when the 65 and the 57X have been
Uh-huh.
suspended. So those
Oh,
buses that went out there.
okay. I learned about VIA from a parent in South County, and she was helping her son utilize it, and it was a game changer because, as with many people, Call Ride involves that, gap where you have to wait and you have to have that window of time. And for some people, not only is that difficult, it can be really frustrating. And I think the VIA has made a big difference. We've had a couple questions about VIA and Call Ride training for people that are going to be providing transportation to folks with disabilities. Are there specific training requirements that they have?
Sure. So the ADA says that all of our employees have to be trained to proficiency in order to serve our customers respectfully, and that we have the technical skills to do the things we need to do. So, for example, on VIA, Call a Ride, or Metro Bus, all of our operators need to know how to secure a wheelchair safely and properly. Our new operators, and we've done sensitivity training also with VIA, so on our new bus and train operators, they learn those things. And also I get the opportunity to go and spend a bit of time, either myself or Tracy, and we do what we call ADA sensitivity training. So we do that. That actually involves a fair amount of videos that were made by people with disabilities about things. So we talk about autism. We talk about hidden disabilities a lot, because anybody can sit in those priority seats on the bus if they maybe they can't stand, or maybe they need to sit up front so they can ask the bus driver a question if they need to. And we can't always see those disabilities. So we try to make sure that our operators understand that.
While we're talking about driver training, I've got another note for myself about safety. I feel like there's always promotion of bad news on the travel, and there's probably lots and lots of times where people make wonderful trips and there's no safety issues. But when I talk to families, I think they have a fear about turning their family member loose on public transportation and what challenges might occur. Are there things that you all like? What kind of data do you look at to assess safety in different areas? How do you know where to deploy your resources to provide the safest trips possible for people on buses as well as the other options?
Oh my goodness. And when you're talking about data and how do we do that, and we're in the midst of this secure platform project, and goodness, Sharon, I think maybe we need to invite our manager of public safety to share some of those things. I will tell you, our vehicles, they have cameras. I don't know if people necessarily always know, but our public safety folks, in their communication center, they are looking with live video of lots of things, and they can zoom right in. Our buses, our newer buses, as they're rolling them out, they've if you've been on one lately, you may see yourself when you're riding the train or the bus. You can see that that footage that's being recorded. We have all the Metrolink platforms, have the passenger assist buttons, but it's a real thing, and it's for us, especially as we determine folks' eligibility. Sometimes there is an interaction between a person's abilities or their disability and how they can maybe recognize an unsafe situation. And those things are taken into account when we're talking about eligibility for call a ride and things.
Are there any videos that would be available to people so they could see what it's like to ride on a bus before they go into engage in an actual bus training or some other kind of experience?
I don't know that we have any, but that
I don't
sounds
either, but
pretty
I think that would
cool.
be really a cool idea. I will say you guys have been really great partners. I can remember when the MetroLink was opening, you opened the route several days in advance to people with disabilities so we could practice riding, which
Mhm.
was really, really helpful. And I think that that's always, that and the travel training has always been really great. We did have somebody submit a great story. She said, did you know that you've got a lost and found at Metro? That her daughter lost her wallet on call a ride that had cash and credit cards. They went down to Midtown and recovered and nothing was missing. Yay. And then another person that asked, I don't want to be a downer, but if I have a complaint, is there a place that I should submit it?
You can call our general customer service, which is that 982-1406. If you want to talk with the call a ride folks directly, you would call them at 314-982-1505. The general customer service is then going to take it and shoot it out to the person or department that can address it. So sometimes if it's call a ride, it makes a bit more sense to call a ride directly. It saves one step in the telephone game.
A really good question came in. Can a caregiver ride with a person on Via or call a ride?
Yes. So
Woo!
on call a ride, someone who is helping somebody is called a personal care attendant and they ride for no fare. On Via, we don't have that, I'm sorry. One thing I do want to shout from the rooftops too, because I'm also proud of this. So our Via fleet, those minivans, they are a mixed fleet and there are wheelchair accessible Vias. So that's something important. They less people can ride in them, but
Yeah.
they do exist.
Cool. And what percentage of the Metro buses have lifts and so forth? Are they all accessible?
Yes, yes.
Cool.
And I believe that our entire bus fleet now has the low floor ramps. I don't think we have any big buses in service anymore that have lifts. And our call a ride fleet is about a little more than half ramps by now, I think.
At one time, you could pre-sign up for employment trips where you are on a schedule. Is that something that is going to be reinstated, or is that something that is happening now?
That is something that we had to discontinue, and we can't add any more or make any changes to existing subscriptions, that's what we call them, because we have a really big operator shortage. And so we have to be able, that subscription thing is called a premium service. So we're very sad that it is not really an option. I would, Sharon, before we go, I know there was the other question about tools, or how can somebody,
If you've got a non-reader, somebody that has maybe a less ability to understand all the different steps to schedule, how can we help people to be more independent with call a ride, I guess, with the scheduling?
I would say if that person, if it's part of their plan and they have some help, have the helper give us a call so we can make sure we got everything good. And then we have people who will practice. They will, we've had folks that will call with their caregiver for a couple of months, and the caregiver's kind of on the other line until they get the routine. Our customer service coordinator at Call a Ride has created a couple of documents. What day should I call if I want to travel on this day? If they tell me about an early window, what does that mean? And she's got every minute listed out. She's also made a chart this is the day I called, this is what time they're going to pick me up. There's a column for did I cancel it? And those are all, they're in Word or Excel, and they could certainly be modified to meet people's needs. However,
That's such a great suggestion. I think sometimes we forget that having more visual information in front of us can really help. And I think that's a really great thought process. We did have somebody else ask just about creative strategies. They asked particularly about getting a ride to and from private school, which is not really something that I know, Amy, you've got a great answer to, but I'll just shamelessly promote that if you contact a family navigator here at the ARC, we'll be happy to look at creative strategies for transportation. So for those of you that know Charting the Life course, we've got a transportation star where we've mapped out not only what Metro has, but what's available for ride sharing in the community. And have you thought about, you know, a bicycle or a walking, or, you know, how do we work through all the different options to make sure you get what you need?
you know, I just want to say, if you're feeling frustrated with Metro or something, give me a call. That's what I want to say. Because we want to do the best that we can for you. And don't let it stew. Call me up, and I can at least listen, and hopefully we can come up with a good solution.